I think that we've had a lot of questions rolling in so far, so we're going to go ahead and jump into the Q&A session. So Melissa, if you want to stop sharing your screen for a moment, and if I can ask all my speakers to begin sharing their cameras, and you guys can unmute yourselves if you like, or only unmute yourself when you're answering a question if you've got kitties and puppies and chickens in the background.
Missy, can you help me remember how to stop sharing my screen?
So you should see, like, if you mouse over the area, there you go. You got it. You got it.
Okay.
Okay, perfect. Thank you all so much for your great talks and your candor about this incredibly important issue that you know, we've been talking about for 10 years now. And so I'm going to jump in and I'm going to kind of spread the questions around a little bit. And if it looks like we're going long, then I might ask you guys to stick around for a little while longer to finish things up. But if we get a lot more questions coming in, then I might just follow back up with each of you to make sure we answer all of these questions. So just to start off with, Melissa, because you were just speaking, we had a question about where the mental health study data actually came from. Was it phone only, and how many people participated? Some of these questions might be more in depth than you can fully answer here, because they wanted to know, like, which states and numbers of participants. So it might be something that if you have a table or something like that, I can share it with the audience in my follow-up email. But where exactly did all this mental health data get collected from?
There were many different studies done, so from a lot of different places, which is great because that means different research groups are collecting information and they can compare and contrast across the different studies with their findings. I'm going to share with you that report that I mentioned. It gives all the references for the many different studies that I was thinking of. My personal group did a study of 2,500 participants in a telephone survey in 2016 across all 5 states in coastal counties in the Gulf of Mexico. So that was an example of a pretty broad, though shallow, survey that came up with some of these data. Other research groups have gone into communities and done much more in-depth assessments by talking face-to-face with people. And then there were those 2 population surveys that used data that are available publicly through the the BERFIS, which is collected routinely through federal funding. Yeah, I can point you to those studies also.
That's great. Thank you so much. So Tom, I've got a question for you, since you've been communicating about the use of dispersants for a long time now. One of the questions was, dispersant applications are restricted to well offshore, and there's little evidence that they were applied anywhere near coastal population centers. Why do so many people think that coastal residents or other cleanup workers were exposed to dispersants, and what can be done to help dispel those misconceptions? Tom, you're muted right now.
There, how about now? Okay, hopefully this microphone works. I guess there might have been some problem with my earpiece. But that is a key question that we do hear again and again, that how did people feel that they were exposed is sort of what it came to. Because I know we can track where the dispersants were applied, either by air, by vessel, by subsea, and we know that they were nowhere near population centers. The volatility doesn't exist. The droplets are designed to fall where they do. But it's about the communication and having what we consider to be a trusted voice. And coming in after spending 32 years with ExxonMobil, I know that that wasn't considered to be one of the most trusted voices out there. And that's a challenge that we have to deal with. So for me, it's been working through the API, IPICA, so the International Association. It's very much like API. But to develop materials that are, I guess, accessible to regulators and the public, help understand what things really do. And we made the mistake, and I think ExxonMobil, as well as other oil companies, or just technical organizations, we figure that we can give people just lots and lots of data and that will answer the question. And it just doesn't work that way. So we actually worked with a firm in DC to look at the spectrum of how people actually get information. So we talk about it being from what we call glance, scan, read, and study. The ExxonMobil approach was, here's 1,000 pages, just go read it. Now, instead, it's got to be a fact sheet. It has to be something like a Sea Grant forum that we've had before. We've done open houses. We've brought people to the OMSET tank, here in New Jersey so they can actually see what dispersed oil looks like. And then just try to help people understand that we don't just do things because, we do them because they're actually the things that make sense. But yes, dispersants by themselves are typically not approved for being closer than 3 miles to the shore. And if there are people around, it's backed off. If there are marine mammals, it's not applied. If we know what's in the water column at the time, we pay attention to that. But it's that misconception, and I guess just lack of trust of, well, big industry for one thing, not necessarily always believing the government either, that the government has the best interests at heart. And I like Richard's, talking about those 8 dispersants to try to find something that was more safe, less toxic. I was on the other hand, where I had the 8 dispersants and we were looking at their effectiveness. So where Richard maybe got 10 milliliters of something, I got 2 cubic meters to take out to see if they actually worked. But it was exactly like you said, we were just trying to find the best solution. And ultimately we went with the Correxa 9500 because it had the best balance, availability, performance, toxicity. But it's just trying to find who are those trusted voices. So we work with people like yourself, listening to Melissa and Richard. I wish I heard some of those things before, because clearly you're talking about things that people don't necessarily understand. Again, it's just trying to hit all bases that we can. We know the internet is a great source of information, but sometimes not the right information. So we're trying to make sure that people can find what's there, but we just need to get out there and find people like yourselves who aren't somebody from the oil industry, because again, we're just coming in with a big hurdle right up front. So I'm okay with that. I'll talk to anybody, but they don't necessarily want to listen to me.
Well, I appreciate you saying that, and thanks for the shout out to Sea Grant about that, because that is something that we are working on, but we find it challenging as well. And Richard, I don't want to leave you out of the Q&A, but I just did want to follow up with Melissa right there. How do you think then that communication and that lack of trust with the sources of information, whether it was coming from BP, whether it was coming from potentially the EPA or from government sources, that communication about potential exposure with dispersants or the use of dispersants, how do you think that impacted the health of our communities?
I think, risk communication is really tough, but really important. And the trust with communities goes hand in hand with successful risk communication. So I think that if there is inadequate relationship building before an event with a community, it's going to be pretty tough to communicate anything. Risk science is particularly difficult to communicate because, it's complicated, but there are a lot of unknowns. And so when scientists say, I think this, some other scientists say, well, what about that? For a scientist, that is a robust conversation to make sure we're looking at our assumptions. And we think that, that's a very good thing to do. From the public perception, what that looks like is we don't know what we're talking about. And perhaps we're covering up something. People, everyone's a psychologist. We're intuitive psychologists, and we're intuitive statisticians. So we use a range of different heuristics or rules of thumb when there is limited or confusing information. And if we don't feel good about something, that's one of the rules of thumb we use. How do I feel? Oh, I feel uncertain, and therefore I don't trust this person, and therefore I'm not going to listen to what they're saying, etc. So these things are all related to each other, and it's tough, but I think we can do better. We know quite a lot from risk communication science about the basic elements of good risk communication. And there are always lessons learned, but I think we will do better in the future, especially thanks to Sea Grant and your efforts.
You make me blush. So, Richard, a question following up with you. Talking about a lot of research has been done, and we know as scientists, we have these internal debates, and you're showing graphs and things about these things, about level of toxicity across the dispersants. So there's a question about how conclusive the research is on the effects of dispersants and dispersed oil on human health. And kind of a secondary one is, do we know any of the limitations of those studies that have been done, whether it's the Coast Guard study or maybe the EPA toxicity studies? How certain are we about those levels of toxicity?
So, okay, we're always a little bit uncertain. You're never 100% certain. I'm not totally up to date on all of the toxicity studies that were done as a result of the oil spill. The The bigger concern than the dispersants for the people doing toxicity studies, though, had to do with the, it was the first responders, the folks out working in the Gulf who were just exposed to the oil, and the smoke and the particulate matter from where the oil was being burned. That was one of the methods to get rid of that. And that, PM 2.5, the small particulate matter, is acutely very, very dangerous. And so the focus on the toxicity studies, the health studies, was more on that, and all that smoke then moving from the Gulf into the coastal communities. And so, as far as I know, there were no studies, human health studies, about dispersants, particularly with or without oil, just because, again, they seem relatively less toxic than the oil itself or the smoke from the oil. Just to say a little bit of uncertainty. So whenever you run a study, whether it's in human cells, which is very controlled, or rats or mice, or with humans, you can never study enough units, enough people, enough rats to know exactly what's going to happen. And especially once you go into human populations, everybody's different. Are you looking at people who are Caucasian or African American or Hispanic? Are you looking at men versus women? Are you looking at old people versus young people? Do you have people who are sick versus well? We're seeing all of this in the COVID studies, and so you would like to have big enough studies to cover all of the diversity of the human population, but you can never afford to do that. And it tends to be kind of, convenient samples that you're getting. And so you're always left with not knowing all the answers you would like to have. But basically what you see, though, is if something is really bad, you see an effect in people. And if something is really benign, you don't see an effect any place. But most cases, whatever effect you're looking at, there's some reason to look at it. And so you'll have some people who are affected and some are not. And drawing definitive conclusions can often be quite difficult.
If I recall, one of the shortcomings that the authors of the Coast Guard study specifically talked about was understanding direct exposure to dispersants, even in cleanup workers, was difficult because a lot of times they were anecdotal stories of potential exposures. So Tom, did you have anything you want to add to that? Because I know you know a lot about the studies of the responders as well.
Yeah, again, those studies were typically self-identification. Were you exposed? Did this happen? And we know that the only people who really potentially were exposed to a significant level of, let's say, dispersant were the people who were actually loading it onto the aircraft or the vessels, but they were the appropriate PPE. There really were no operations where the general public or the responders who were doing the mechanical cleanup would have been exposed. So, on this National Academies committee that I was on with Mary Landry, who was the chair, she was the first federal on-scene coordinator for the response. So and she's Coast Guard. She was a retired, or is a retired Rear Admiral, and had a chance to talk to her, and she was kind of not very happy with the way the Coast Guard study was released and talked about, that it really wasn't all that, I'll say, it didn't necessarily have a lot of the background, didn't have the baselines. It was a difficult one to do, but as Melissa said, well, we learned also there's a human health effects chapter of the National Academy's report on evaluation of dispersants, and we learned pretty quickly that while we can say probably pretty well that nobody got directly exposed to dispersants to a level that you'd expect to see negative health effects, the fact that you feel that you were damaged or you feel ill effects, we only this time around finally realized that that's an important thing to think about. Because we used to say, well, you didn't, so just don't worry about it. It's like, yeah, that doesn't really work. The thing your mind can do to you is pretty significant, especially if you have all these other stressors that already existed because you might be in a community that's challenged. And then if you do think that you got exposed to something, it's real. But how do we assess it before the fact, at least know what the baseline is? And then what do we do after that? How do we make it better? But it is that sort of being open, and the comment that Richard had about the components, the proprietary components within Corexit 9500 or CBRAT number 4 or any of those. It's just, there must be a reason you're not telling me. Like, no, I came in through the chemical side, and I understand why formulations are proprietary, because you spend a lot of money to develop something. In this case, we've tried to make sure that response-related technologies, the industry does not make money from, because we really want to do the right thing. And ExxonMobil has been doing oil spill response research since the Valdez and actually before, and we keep doing it. And if we get something that works, we're going to share it. But yes, I understand where NALCO was coming from, and we're suffering the consequences now that they just took too long. But it's that mental health aspect that can really be much more significant than I ever would have thought. But Bernie Goldstein from University of Pittsburgh, Julia Golke, they really helped us understand that.
So one of the questions we also have, and I know it's potentially outside the bounds of the experiences of youth 3, but there was a question about any studies that were performed that actually monitored water quality, looking specifically at dispersants in our coastal areas to understand whether or not there was dispersant that reached our beaches just by washing up normally with the tides. And so I'm not sure if any of the 3 of you could speak to that.
So I know Tom may know more, but I believe there was, sorry,
Crickets.
There were studies done, and the level of dispersant was below the level of detection all along the coast, which means, they could detect down to, Tom probably knows the number better, sub-part per million, but they simply couldn't find anything. Is that right, Tom?
That's absolutely correct. There are still cases where some tar mats and tar balls are being found that might have a component. It's typically the dioctyl sodium sulfosuccinate, the DOS. They're still finding potential indicators that it's still out there where it got sequestered into something like an aged tar sample. But the levels, again, from an action standpoint or a health standpoint, are really pretty insignificant. And I will say that CEDRA, so the research organization in France, did some studies a while back where they were looking at the possible application of dispersants even near shore, which from a net environmental benefit analysis standpoint would say there are going to be cases where it's the right thing to do if it prevents oil from washing up on the shore, where then you have exposure to the organisms or the public. And everything is a trade-off, and that's not necessarily a bad thing. It's just we have to understand the risk. And risk communication, as Melissa said, is huge. And if you've ever met Ann Hayward Walker, she's been helping us quite a bit, at least understand how people, I guess, take information in and what they do with it. But no, I personally wouldn't be concerned, but that doesn't do much to help people feel better.
We do know that there was monitoring, at least, that was being conducted at the time. And so I appreciate that answer. So we're already starting to head over time a little bit, but if you guys are willing, I do have just a couple other questions that I wanted to see about getting answered if you have time. So one of the questions, Melissa, and this is something I know that we've talked about before too, and you've shared a lot about, is how do we build psychosocial resilience towards the next oil spill?
Well, you grab my report, you implement all the recommendations. Oh gosh, for me, it's about pre-positioning resources, whether it's monetary, it's social relationships, it's education, it's having access to healthcare, the right healthcare when you need it, and helping communities to think through what their values are, what their long-term goals are that they're trying to move their community towards, whether it's a development plan or a hazard mitigation plan. But it's got to involve people, and it's got to have local input and buy-in. And federal agencies, local, even state agencies are the ones responding to disasters like this. But none of their efforts are going to be very effective if they don't have the cooperation and help of local members of the community who are listening to experts and trying to figure out what to do, but also who have their own local knowledge about, who lives where, who is most vulnerable, and how existing local networks can help in mitigating the impacts of disasters. So there's lots of things that we can do, but I think it all comes down to really knowing your community and thinking through how you can spend existing resources or pre-position resources for a disaster event.
So just kind of put a bow on it on the end here, and I float this out to all. One of the things that's come up multiple times during today's webinar is a lack of baseline data. Whether it's lack of baseline data on mental health, on physical human health, on how ecosystems were going to respond to these types of things. It's been 10 years. Knowing what we know now, do you think we are better positioned with the baseline data that is available? Are we in a better position to understand how we're going to use these types of tools, how we're going to communicate the use of these tools, and how we're going to help our communities respond? It's really just, what's your thoughts?
I'll jump in because this is one thing I'm very passionate about. From the social science perspective, we do not have the right infrastructure in place. If you think about NASA or NOAA, or the physical scientists are probably wishing they had more technology and observing systems funded at better levels, but I'm so jealous of all the monitoring that goes on regardless of what's happening with the Earth and the environment. And I wish we had something that was better resourced for the same on the social science side. Are we better off? Yes, we have a lot more data than we had pre-Deepwater Horizon, but it was collected in a non-normal time for a very specific reason. So, our group, for instance, has tried to use the initial survey we did as baseline data to see what happened after hurricane season in 2017-18. But we didn't necessarily collect all the data that we needed for those comparisons for a different disaster. Hurricanes and oil spills are very different in many ways. So there's still much more that we need to do.
Okay, I guess I'll jump in next. And just say, NOAA does these sessions every week now. They've got speakers, and it's called You Don't Know What You Don't Know. And I think that's where we were 10 years ago. And now we know a lot of the stuff we didn't know, and we know how to collect it a lot better. So even to the standpoint of stopping an uncontrolled blowout, now we have equipment that didn't exist. We can go down to 5,000 meters. We can go to 10,000 meters. We can do a lot more that didn't exist. We can collect water samples through the water column all the way down with these kits that exist that we can get deployed pretty quickly. And then working with Gomri and others, we have a pretty good core group of scientists who now have had gotten their feet wet literally out there doing all this stuff. So now you can call on people and say, look, you did the study, what worked, what didn't. And I think we're just in a better place from trying to collect the data that matters. And the other thing I would see is that hopefully we can collect the same data. So for the natural resource damage assessment, that's being collected for one purpose, but we like to collect things for something else. Hopefully we can collect the same samples, and then at least we're talking on the same subject to some extent. So again, I think we're just in a better place.
And I know Melissa has to go and jump off right now, and I'll follow back up with her if there's any additional questions. But Richard, I'm just curious, do you figure that the US EPA and your colleagues are better suited to answer the call? I know that was a rapid study that you had to conduct because dispersants were already beginning to be applied, but do you feel like you and your modeling cohort are better positioned to help jump on top of a disaster in the future?
No, we had to make up stuff on the fly, and at least if knowledge decays, right? So I'm going to retire at some point here, and and let's just hope there's not a disaster before I retire. But anyway, we have a good toolkit, and technology is changing all the time. So I really just reiterate what Tom says. There was a lot of learning, and it was published. It's out there for people to read again. So I think if there is another Deepwater Horizon, the response will be, we'll be able to respond better and keep the effects even lower than they were this time. Let's just hope that doesn't happen again, though.
Exactly. And your comment about people potentially retiring, as I said, I have retired, but it lasted a weekend. But the Clean Gulf Conference is coming up in October. It'll be in San Antonio, but I'm part of a session that's on knowledge transfer. And it's just like you're saying, because we've got a lot of responders who've got a lot of experience, but they kind of look more like me than they do Melissa. You know, that's just age. You know, it's like that's the way it is. So how do we capture that? How do we transfer it? Let's not lose it.
Okay, are you able to see my thank you slide?
Yep.
Yes.
Okay, so thank you all for sticking in there. Thank you to my speakers for sticking in past the time. It's an important topic, and I'm glad we were able to cover it, even though we could probably do this every day, you know, for the next month and still have a lot of questions remaining. But I do want to ask those of you that are still aligned to please click that link and fill out the evaluation. I will be doing a follow-up email when those videos go live and ask you again to hit that evaluation. So if you don't do it now, I'm just going to pester you about it later on. We do have the final installment of the 3-part series of oysters and oil spills coming up on September 14th. So go to our website and you can register for that webinar there. And then we also have a Focus on Louisiana webinar scheduled for September 23rd, which happens to be my birthday. So that's a great big birthday gift for me that I'm actually going to be getting to share during that as well. And again, we're thinking about all of our colleagues in Louisiana today and hoping that everybody is doing okay. Thank you to my speakers once again. I can't tell you how much I appreciate your time and your willingness to share. And with that, I'll say goodbye.
Thank you.
Bye-bye. Thanks.
Appreciate the opportunity. Yeah.